The Zambia Health Education and Communications Trust, ZECT, was registered under the laws of Zambia in October 2001 as a non-governmental, not-for-profit organization. The organization commenced operations in April 2002 with the main goal of contributing to the improvement of the health status of Zambians by implementing an HIV and AIDS prevention and mitigation program targeted to employers, employees, and their spouses, partners in workplaces, families, and communities. ZECT has been implementing various projects for 10 years now.
So the activities that we are providing to the community are voluntary counseling and testing, or VCT in short. And this we use three strategies. We go out for outreach with our tents that we mount in places like markets, churches, and the community, and we provide the services. Secondly, they can also find us at the static facility, the building where we are. Thirdly, there is an innovation by ZECT, which has made us introduce the door-to-door, where we are able to move and find people in their homes and provide the services that they need. And the services, as I said earlier, we are providing VCT. That's number one. So we are using the three strategies. Then we are also providing family planning services. And we are also doing malaria screening. So when we go out, we provide all these activities in one package to the community.
ZECT's interventions include HIV counseling and testing, capacity building in both communities and workplaces, advocacy in health and social issues, development of information, education and communication materials, IEC, linkage creation for antiretroviral therapy, ART, continuum of care, male circumcision, cervical cancer and TB, screening and treating for malaria, diagnosing and treating sexually transmitted infections, STIs.
The door-to-door has been appreciated greatly, because for the households where we have been to, the receivers of the activities have appreciated the fact that they can receive these activities in their home environment, which saves on their time as opposed to traveling long distances to get to these services. So we are receiving a lot of support from all members of the community for this service.
The organization has grown from a small entity with a small staff complement, all based in Lusaka, to a major health education organization with a total of 104 employees and offices across the country. ZECT has its head office at plot 1551 Fairview on Church Road in Lusaka. The organization is also operating 10 corridors of hope sites in Kazungula, Livingston, Solwezi, Chililabombwe, Sesheke, Nakonde, Chipata, Katete, Chirundu and Kapirimposhi. This is in addition to 2 other sites in Choma and Chipata, which are Zambian-led prevention initiatives. ZECT answers to a fully constituted board of directors composed of 8 experienced, skilled and credible men and women who give the organization technical assistance and strategic direction. Although ZECT's offices are only in 5 districts, its scope of operations spans the entire line of rail from Livingstone right through Lusaka to the Copper Belt, as well as rural areas as shown on the map. This has provided ZECT an opportunity to get to all the 10 provinces of Zambia, covering a total of 49 districts.
ZECT has trained some peer educators for Lumwana Mine, who are working in Lumwana Mine as well as the surrounding community. Then also ZECT helped Lumwana Mine develop the HIV workplace policy, which is being implemented by the mine. We have also had instances where the mines, both Lumwana and Kansanshi, have invited us to provide some activities in their environments. So we are having this collaboration with these mines, and for us it's a good thing.
During the 10 years of the organization's existence, ZECT has scored the following notable successes: training 1,400 peer educators, sensitized more than 1 million people, counseled and tested more than 100,000 people, trained 481 palliative caregivers, referred more than 5,600 clients for ART, trained 172 trainers of trainers, trained 208 psychosocial counselors. Since its inception, ZECT has received funding from various donors such as the United States Agency for International Development, UNFPA, and DFID, Funding from these donors have enabled the organization to implement multifaceted programs that include distribution of both male and female condoms, as well as behavior change communications campaigns, BCC. Today, ZECT has evolved to become the key research institution in Zambia in such areas as CAP surveys, HIV prevalence surveys, project evaluation, end-of-project surveys, developing manuals on different topics. ZECT adopted a deliberate policy to reach out to groups of people on the fringes of most BCC campaigns. These are the people with physical handicaps such as the blind, the deaf, and those with other physical handicaps. In an effort to empower youth, ZECT also runs a project called Delayed Sex Debut, DESED, which trains school children as peer educators to promote delayed sex debut, trains teacher champions to incorporate abstinence in the school curriculum and teaching, promote and facilitate HIV counseling and testing in schools and communities, make boys and girls become masters of reproductive health in their schools and communities, help parents, guardians and teachers work together in the prevention of early sex and marriages among children.
What you need to do is to be focused, to be serious about what you are doing. Don't listen to all these little boys who are coming around and telling you you are beautiful, they love you, and if they love you, they'll wait for you, won't they?
It is the vision of the board and the management team to continue growing the number of people and the spectrum of services that ZECT reaches with its interventions. For more information, visit ZECT's website at www.zhect.org.zm. ZECT, offering holistic health solutions.